Good afternoon. Last week, I laid out what we need to do to beat the COVID-19 pandemic and the challenges posed by the Delta variant. This is a very different variant than what we've dealt with previously. It's highly transmissible, and it's causing a new wave of cases. It accounts for over 80% of all COVID-19 cases in the United States today. Experts tell us that we're going to see these cases rise in the weeks ahead, a largely preventable tragedy that will get worse before it gets better. What's different about this surge from previous ones is we have the tools to prevent this rise in cases from shutting down our businesses, our schools, our society, as we saw what happened last year. While cases are on the rise, it's important to note we've not seen a comparable rise in hospitalizations or deaths in most areas of the country. That's because 165 million Americans are fully vaccinated, including 80% of the most vulnerable Americans, our seniors. The best line of defense against the Delta virus is the vaccine. It's as simple as that, period. The vaccine. I want to be crystal clear about what's happening in the country today. We have a pandemic of the unvaccinated. Now, I know there's a lot of misinformation out there, so here are the facts. If you're vaccinated, you are highly unlikely to get COVID-19. And even if you do, the chances are you won't show any symptoms, and if you do, they'll most likely be very mild. Vaccinated people almost never are hospitalized with COVID-19. In fact, according to one recent study, 95% of overall COVID-19 hospitalizations are among those not fully vaccinated. And the data shows that virtually all the cases, hospitalizations and deaths due to COVID-19 are from the unvaccinated population. Last month, a study showed that over 99% of COVID-19 deaths have been among the unvaccinated people. 99%. That means if you're unvaccinated, you are much more likely to, 1, get COVID-19, 2, get hospitalized, and 3, die if you get it. This is a tragedy. People are dying and will die who don't have to die. The data is absolutely clear. As I've said, we have a pandemic of the unvaccinated. Think of it this way. 191 million Americans have gotten at least one shot, including 70% of adults over the age of 18. 165 million Americans are fully vaccinated, but about 90 million Americans are eligible for vaccines and still haven't gotten their first shot. You know, I think there's a clear link between the lowest vaccinated, the lowest vaccinated states and the states with the highest case rates. This past week, the most vaccinated state in America, Vermont, has seen just 5 new cases, 5 per day of COVID-19 for every 100,000 people who live in that state. That means on any given day, only 30 people in the entire state of Vermont got COVID-19. Nearby Maine, which has vaccinated almost 80% of their adults, has seen just 6 new cases per 100,000. But the state with the lowest vaccination rates are seeing 10 to 20 times as many new cases per 100,000 people. It's moving like wildfire through the unvaccinated community. And it's heartbreaking, particularly because it's preventable. That's why we're doing everything we can to get more people vaccinated. And we're seeing real results. In the past 2 weeks, we've seen a 55% increase in the average number of new people getting vaccinated every day. In the last 7 days alone, nearly 3 million Americans have gotten their first shot. That's the highest 7-day total in a month. Importantly, over the past 2 weeks, the 8 states with the highest current case rates have seen a doubling of the number of people newly vaccinated each day. The message is getting through, apparently. Louisiana has seen a 212% increase in the average number of newly vaccinated people in that state per day, going from 3,600 to over 11,000 people vaccinated per day. Arkansas is up 99%. Mississippi is up 125%. Alabama is up 186%, going from 3,200 to 9,150 people vaccinated per day. This will make a big difference. These are encouraging signs. We have to continue our aggressive efforts to vaccinate the unvaccinated. Last week, I announced additional steps to incentivize Americans to get vaccinated, including calling on states to offer $100 for anyone willing to step up and get a vaccination shot. You know, and already Minnesota and New Mexico have done that. And North Carolina announced its $100 incentive today. Places that have offered the $100, that'd be really good. I'd go back and get vaccinated 3 times. But all kidding aside, offered the $100 to get vaccination have seen an uptick of 25% in daily vaccination rates. We also announced that small and medium-sized businesses will be fully reimbursed for offering paid time off for their employees to get vaccinated, and for them to take a child or a parent to get vaccinated. And I announced some tough, sometimes unpopular steps to keep people safe and our economy strong. All federal workers must report their vaccination status or be subject to strict requirements. Any federal worker who does not attest to their vaccination status or is not vaccinated will be required to mask no matter where they work, test once or twice a week, socially distance, and generally will not be allowed to travel for work. I directed my administration to take steps to apply similar standards to all federal contractors. If you want to do business with the federal government, get your workers vaccinated. And I also directed the Pentagon to look at adding COVID-19 to the list of vaccinations that are required for our troops, because the others are required. I approved the Department of Veterans Affairs to require doctors, nurses, and other healthcare workers who care for our veterans to be vaccinated. And the good news is that now many are following the federal government's lead. In the past several days, states and local officials have come out to impose similar vaccination mandates. And the private sector is stepping up as well. Even Fox has vaccination requirements. I want to thank Walmart, Google, Netflix, Disney, Tyson Foods for their recent actions requiring vaccination for employees. Look, I know this isn't easy, but I will have their backs and the backs of other private public sector leaders if they take such steps. But others have declined to step up. I find it disappointing. And worst of all, some state officials are passing laws or signing orders that forbid people from doing the right thing. As of now, 7 states not only ban mask mandates, but also ban them in their school districts, even for young children who cannot get vaccinated. Some states have even banned businesses and universities from requiring workers and students to be masked or vaccinated. And the most extreme of those measures is like the one in Texas that says state universities or community colleges could be fined if it allows a teacher to ask her unvaccinated students to wear a mask. What are we doing? COVID-19 is a national challenge, and it must come together. We have to come together, all of us together, as a country to solve it. Make no mistake, the escalation of cases is particularly concentrated in states with low vaccination rates. Just 2 states, Florida and Texas, account for 1/3 of all new COVID-19 cases in the entire country. Just 2 states. Look, we need leadership from everyone. If some governors aren't willing to do the right thing to beat this pandemic, then they should allow businesses and universities who want to do the right thing to be able to do it. I say to these governors, please help. But if you aren't going to help, at least get out of the way of the people who are trying to do the right thing. Use your power to save lives. I've made it our first and top priority to have a vaccine available for every single American from the day I got elected. That was my priority. Let me be clear. We have a supply for every single American, and that will never change. At the same time, it's also in our national interest to share some of our vaccines with the world, which gets me to the second thing I want to discuss today. From the beginning of my presidency, I've been very clear-eyed that we need to attack this virus globally, not just at home, because it's in America's self-interest to do so. The virus knows no boundaries. You can't build a wall high enough to keep it out. There's no wall high enough or ocean wide enough to keep us safe from the vaccine and from the COVID-19 in other countries. In fact, just like the original virus that caused COVID-19, the Delta variant came from abroad. As long as the virus continues to rage outside the United States, potentially more dangerous variants could arrive at our shores again. And we know that COVID-19 in other countries stifles economic growth, disrupts supply chains, risks instability and weakness of governments. And as we've seen in the United States, the key to growing economies is to vaccinate people. So just as the American economy is recovering, it's in all of our interest to have the global economy begin to recover as well. This is about our values. We value inherent dignity of all people, the inherent dignity of everyone. In times of trouble, Americans reach out to offer a helping hand. That's who we are. And I've said before, in the fight against COVID-19, the United States is committed to be the arsenal of vaccines, just as we were the arsenal of democracy during World War II. We're backing up that commitment. We've contributed more than any other nation to COVAX, the collective global efforts delivering COVID-19 vaccines across the world. We've supported manufacturing efforts abroad through our partnerships with Japan, India, Australia, known as the Quad. During my trip to Europe in June, I announced that the United States has purchased a groundbreaking 500 million doses of Pfizer and then donate those doses, to nearly 100 low and middle income countries who don't have the vaccine. Those doses will start to ship at the end of this month. We also announced that we donate 80 million doses of our own vaccine to supply the world, which has already begun. And today, I have an important update. We've already exceeded 80 million doses that have gone out. As of today, the United States has shipped over 110 million doses of U.S. vaccines to 65 countries that are among the hardest hit in the world. Let me say it again. As of today, we have shipped over 110 million doses to 65 nations. According to the United Nations, this is more than the donations of all 24 countries that have donated any vaccine to other countries, including China and Russia, all those nations combined. These vaccine donations from America are free. We're not selling them. There are no demands, no conditions, no coercion attached. And there's no favoritism and no strings attached. We're doing this to save lives and to end this pandemic. That's it. In fact, we're donating vaccines to countries that have real issues we have real issues with. And we'll continue to give tens of millions of the doses away across the summer and work to increase U.S. manufacturing of vaccines around the world as well. And it's not just vaccines. We're continuing to provide countries in need with more testing, protective equipment, and personnel to stem the surge of the virus. We've done it in India and elsewhere. Let me close with this. I've said before, in the race for the 21st century between democracy and autocracies, we need to prove that democracies can deliver. And the democracies of the world are looking to America to lead again in two ways. First, to demonstrate we can control this virus at home. And second, to show we can help address it around the world. Vaccinate America and help vaccinate the world. That's how we're about to beat this thing. We're always going to have enough doses for every American who wants one. Our work in donating vaccines to the world is about America following through on our promises and delivering what we say we'll deliver. It's showing how American science and technology, American business and academia, and our government can all work together. Above all, it's proving democracies can deliver. And yet again, that America is back leading the world, not by the example of our power, but by the power of our example. We still have a lot of work to do. So if you're unvaccinated, please, please, please get the shot. But just don't take it from me. Just read the news. Listen to the voices of the unvaccinated patients in the hospital. They're spending the most powerful message to their families and everyone around the world. A powerful message to everybody. As they're lying in bed, many dying from COVID-19, they're asking, "Doc, can I get the vaccine?" The doctors have to look them in the eye and say, "No, sorry, it's too late." Right now, too many people are dying, are watching a loved one dying and saying, "If I just got vaccinated, if I just." Folks, this isn't about politics. The virus doesn't care if you're a Democrat or Republican. This is about life and death. Life and death. I can't say it any more plainly than this. The vaccine saves lives, and it could save yours or your child's. I know we can do this. We're the United States of America. We're prepared like never before. We have the tools and the resources to save lives at home and around the world. This is who we are. This is what we do. This is why there's no nation like us on earth. God bless you all, and may God protect our troops.